In just a minute, we'll be meeting with Lynn Johnson, who's the Assistant Director of the Administration for Children and Families. That is a division of the federal government's Health and Human Services Department. I met Lynn for the first time last February as she was doing a tour around the Western states. She came to our Magnolia Family Center and in particular wanted to hear about what we were doing with the Magnolia Community Initiative, an effort towards community level well-being, and to see how it fits into her promotion of primary prevention. I'm really excited to be meeting with Lynn today. Thank you for joining us. Really appreciate it. So I really appreciate you joining me today, Lynn, and Assistant Secretary Johnson.
You're fine, Lynn's good.
And really the conversation that I wanted to have with you really centers on the concepts of primary prevention that you and I talked about last February. And over the last 4 years, the Administration for Children and Families have really been pushing the concepts of primary prevention. And honestly, in my 20 years of working in child welfare, I haven't seen anybody under any administration in any frame, state, federal, local, really focus on primary prevention the way you have at ACF. And I really just wanted to understand, how the topic came about, how it emerged, and kind of what you've done to share your thinking, because this is really at the core of what we do at Children's Bureau. And the alignment has been so wonderful, as we talked about last February. If you wouldn't mind.
I don't mind at all. So, it's such a great question, because first I would have to tell you a little bit about where I come from.
Yeah, please.
And when we talk about, I came from, Colorado. I've worked at a governor's office. I've worked in a county. I was probation and parole officer for 18 years. And I'll never forget when one of my long-term offenders came into my office and he said, I want you to do a urine sample because it's going to be hot. And I said, well, do you want to, what are you doing? He goes, I have been working with human services. At that time, it was social services for 3 weeks. And I just need to go back to prison to clear my head. And that made me say, something's wrong with our human service system. But I was in the judicial criminal justice system. Yeah. So of course, we're good and they were really messed up.
Yeah.
And so when I went to work for the governor, he had said, I know you're a critic of the current system. What can be done different? And one of the biggest things I said was, if human services, social services worked and caught people on the front end, my caseloads would have been a quarter of their size. Yeah. I know that if we as a community served people better, wrapped around people better, got to people before, in the health world, before the heart attack happens, you already start exercising and eating right. We can do that in families around the social service issues. And yet, and we all talk about it, as you and I did, we always hear people say, boy, if we could just catch them before they get to this chaotic place. But we don't put anything into that.
Yes.
And so that led me to this. It led me to this in my previous human service work, and then sitting here in this position at the Administration for Children and Families, knowing that we get one shot to sit in the seat that you're in and to be able to make a difference in communities for the people that we serve. And it was primary prevention. I came on board, Jerry Milner was already doing this work with the Children's Bureau, really doing what he could, meeting with states to prevent kids from being removed from homes for the wrong reasons. Looking at a child that's been removed because they didn't have a mattress. And I do the math in my head and say, so the cost of the 7 years in foster care ended up being when we could have bought a mattress and maybe helped dad find a new job. Those are the kind of things, I think, common sense management that we absolutely have to get to. We have to start having a bigger conversation, and primary prevention gets us there. But another piece, a very dear friend of mine who was a state director, Susan Dreyfus, said, well, I love that you guys are doing primary prevention, but what about the 480,000 kids already in your system? And that's when we started the All-In Adoption Challenge to say, we have 122,000 kids in the system. That what you focus on gets done. Let's get these kids moving and not have them sitting. So I hired a young man who sat for 2 decades in foster care to help guide youth engagement and to help us know, how do you do primary prevention right? We don't want kids staying where they're being abused. And how do we help them move so 20,000 kids don't age out of the system? So that's what's triggered it. That's what got us started. And then it became like a pit bull mission.
That's just wonderful. And I love the fact that you engaged with children, young adults that had come through the system as a means to kind of help fine tune and really look at the work. You know, as a service provider, there are times when we think about the service and delivering the service and not really thinking more comprehensively what's around the individual receiving the service, the context that they live in, the family, the community, the whole environmental context really does have an impact.
Right.
And so reaching out to community or to individuals that have experienced that have been, I'm sure, was really, really helpful in your thinking and reinforced some of it, by the way, I'm sure too.
Yep. Yep.
So over the last couple of years, what have you been doing to kind of move that thinking forward? I know you've been traveling across the states, and again, because we were the wonderful recipient of a visit. Other things that you've been doing to understand and how to kind of share your thinking and spread the concepts more deeply in communities?
Well, I have personally called and talked to over 30 governors and talked to them about what it means to take away the emotions and the emotional, the heart of the work that we do, the economics of the front end services versus waiting for that heart attack. It makes sense for taxpayer dollars. It makes sense for the workload of our child welfare workers or the workers that are in the nonprofits or our faith groups that are helping wrap around our families. The workloads are what I hear the most about, is workloads are really hard and they are really keeping people from doing what they dream they wish they could do in these systems. But I kept thinking, if we focused on the primary prevention and focus on the 122,000 kids, it was 126,000 I think when you and I first talked.
Yes.
We focus on this, that what you focus on gets done. And right now, I can't even tell you how often people have said to me, what can we do to help child welfare? And I throw everything about child welfare at them. Yeah. And next thing you know, they're saying, thanks, really good to know you. Yeah. So now I've picked off two things that have domino effects so they can move forward and say, what can we do? Here's what you can do to help get these kids forever homes. And if you don't want to be the one adopting or be the foster parent, here's how you can wrap around a foster parent or an adoptive parent or mentor a child or help them because they're getting ready to age out. Or I've got a list of actual action. And then same thing with the front end. How do we, before that phone call comes to the hotline, how are we putting community together to wrap around struggling families so you never get that phone call in the first place? We have seen, because Jerry Milner has been to every state probably 2 or 3 times, I've called the governors and said, will you make this a focus of your state? Will you work well with those nonprofits, faith-based groups, philanthropy? Because everybody owns a piece of the success of America's kids that are sitting in our foster care system. So we need, and the kids that are struggling before they even get into kindergarten. And so how do we do this? And communities are ripe for this right now. They are loving the fact that the stars are aligned, that everybody's working toward the same common goals. We know where we're going and we're measuring it. And it works. These aren't things that are too hard. These are things that are truly, truly doable if everybody owns a piece. So that's what I've been doing, is really traveling, talking to people from the NFL, talking to Hollywood, saying, can we get awareness out? Because that's what people say. I didn't realize the numbers were so high. I didn't realize there were these things we can do. And then working with Congress, of course, because we do need some flexible funding to wrap around these families and working with them on that. And then in addition to that is the kids. I hired a young man and he's working for me, and then he has brought along a youth engagement team, and then that team is talking to other teams in states. Those kids have brought me things that, and one example was, they said they hate the fact that our forms say they are legally free youth. They said, we're not legally free. We're not free. We never were for sale and we're not for free. We
Great.
don't like those words. It just really hurt them. So we changed those forms.
Right.
And we're telling others throughout the country, because as you know, child welfare services are primarily directed by the state and the localities that do it. And we don't want to dictate. What we want to say is, how can we at ACF serve you? And so I have spent my entire 2.5 years here asking people what they need and then coming back and doing it.
Well, I was one of the reasons why I reached out, because I found that to be incredibly impressive, delightful, and well aligned with the work that we've been doing. And I just can't thank you enough for that. You know how much I agree with you in the concepts and the framework, and understanding how we can move further upstream to prevent children from entering into the welfare system in the first place. And really focusing on community level well-being, because families live in communities and children live in families, as we've talked about. So thank you. With that in mind, so what are the next steps and the vision for the future? Where do we take this? And do you have any specific plans? And just thinking more broadly about what could be and can be, using what you've learned so far.
You know, that's probably the hardest part about being in a position such as this, where you're there for a certain time and then you're not. And we really are just seeing the momentum with the all-in challenge on primary prevention and taking care of those that are waiting. The momentum's really moving, and it's been such an honor to sit in this seat and serve this country, and those that I've not met anybody that doesn't passionately care about these kids. And together we're all moving this to a really good place. So I'd love to be able to keep the bully pulpit going. I have talked to others about, we just can't stop now because of a change in administration or anything that happens. I don't know what my future will be. I've not even thought about that, because we're not done. I'm working with everybody still, and working with the kids and making sure that everyone, and I worked with both parties across the board since I've been here, that everyone knows that this is not a political all-in primary prevention. This is about outcomes and caring about these kids, and we need to keep this moving forward. And so working with others that have said they'd like to keep helping do that, I'd be thrilled to keep it going in some form, to serve and keep helping kids. If I don't, the kids that I've got on my teams now, I'd like to move them all into my house and just have them all have a forever home. And my husband's just laughing at me about, oh, maybe you should go back to DC. But it's, these kids matter. They are awesome. And everyone, teenager or not, teenagers are teenagers, these kids deserve forever parents. And a lot of these kids don't need to come into our system if we do that primary prevention.
Yeah, I couldn't agree with you more. And, we have to recognize the fact that when we're talking about the well-being of children and child welfare and families, it's not a political statement, has nothing to do with politics. It has to do with humanity and who we are as individuals and who we want to be as a country, and how do we help people have an opportunity to be successful in life, at least the best that we can create for them. Yeah. And so with that in mind, I'm more than happy. Again, I think you've been incredibly successful. Even in the time that I've known you, it's made a difference. And I know that we work in a big nation. And so is there anything an organization like Children's Bureau can do to help you, to help ACF, to help the thinking, Jerry Milner, to help just the conceptual framework, and really to help support you continue in your efforts? I'm happy to do whatever you can guide me to do.
I appreciate that so much. And it really does take all of us remembering to keep the focus. And what I learned, and you've done this too because of the Children's Bureau, as we move through the country, fads come and go and requirements come and go that are required through the federal level. And my goal was to truly remind people that no matter what else is wrapping around the system, preventing harm to children and making sure kids don't stay stuck in a government system are two things that are never going to go away unless we focus on that. And it's no matter what is expected from an administration, and no matter what's expected from a nonprofit or a for-profit, those two pieces are just standards. And if we can remember to care for these kids and care for their families, we can't do this without whole family, 2-generation, whole concepts. And you're doing it. I saw you doing it. But we can keep that going and stand up and fight for that. And I think that's what, if I had any magic wand for the future with me not in it, is that people that are really doing this work today keep this going and don't say, okay, we're done now, what do we do next? We're not done. We are at 122,000 kids still waiting. We have, for the first time ever in history, less kids coming into the system last year, 2019. I don't know what COVID will have done to those numbers. We also know that we had a flattening of the number of kids that were waiting and more kids adopted than before. So somehow, because of the work you're doing, the work others are doing, because of all of our communication, things are turned in the right direction. Let's not stop that. But that means bully pulpiting. That means standing up and saying, what are we doing to get these kids into forever homes? Josh, who I hired 2 decades in the system, said, when they said he was 16-ish, and he said, they said, well, we should probably do an adoption plan. He said, you didn't worry about getting me adopted at 5, at 10, at 15, and now you want to? Forget it. I will age out without. And very wonderful, at age 23, he gets adopted as an adult. But his anger of aging out of a system that he spent almost 2 decades in is not what we should be proud of, and not what should be happening. But it seems like the more conversations we have, when we revert those numbers to percentages, it doesn't sound that much. But when you look in the eyes of each and every child that has aged out, or who has spent 10, 15 years in a system, and or 20 moves, 40 moves. I just met somebody that had 92 moves. We have to finally start saying that is not okay.
Thank you so much.
It's such an honor to hear you speak that way, and I appreciate you asking me these questions. Thank you.
Thank you, Lynn. And take care, be safe, and have a wonderful holiday season.